Hi, everyone. Welcome to our session. Today, we will discuss how modern data platforms are transforming healthcare. I'm Megan Dollins, Director of Strategic Partner Marketing at Impetus Technologies. In my role, I collaborate closely with our partners to tell the story of how enterprises are modernizing their data strategy to become future ready. Today, I have Rachna Salgia, the co-founder and president of DigiValet, with me. Rachna brings with her almost 30 years of experience as a seasoned technology leader, leading engineering teams across different regions and delivering a diverse range of products and services to clients in healthcare and hospitality. Throughout her career, Rachna's unwavering passion for data and transformative power in the healthcare and hospitality sector has been truly remarkable. Thank you, Rachna, for joining us today.
Thank you for having me here, Megan.
Let's dive right in. Rachna, considering your extensive experience, can you share with us how you think modern data platforms are impacting healthcare organizations today?
Yes, healthcare industry is generating petabytes of data, which is getting more complex over the next few years. And the fact is that all of this data residing in different systems and silos across various departments is making it further challenging. So we all know that data is an asset, but not being able to leverage the data for the delivering of better quality of care is certainly a lost opportunity. And that's where the modern data platforms play a role. So all this while, this industry has been dreaming about providing data-driven experiences to the patients, to the clinicians, and modern data platforms helps enable that. I mean, it's not just a necessity. I would say it's the only way to future-proof the healthcare businesses. There are healthcare leaders who are envisioning a world where they can prevent diseases before it strikes. And I would say the use of modern data platform exactly presents those possibilities and promises. So yes, certainly.
Well, that definitely sounds hopeful. Can you share some examples that might highlight these impacts?
Sure. And I will share examples from our own experiences. I mean, we are specialists in designing digital experiences, and we have taken that expertise to some of the smart healthcare organizations. So I will just, let's imagine you and me as a patient, we are admitted in one of those hospitals for one of the surgeries or one of the procedures. Now, using modern data and, how do we enhance the patient experience? I'm going to just, help you visualize this. So you go to this hospital, you get admitted, you have a surgery tomorrow. And there you get a patient education material, a video that what do you expect in surgery? Here is your care team. And, you would know what exactly your schedule is going to look like, how many hours you're going to be in the operation theater and how do you come out and what to expect post-surgery. And that takes away all your stress, anxiety, you feel relieved. After the surgery, you have a dietitian, you have a consultant who's going to work with you to design your meal plan, nutrition, wellness modalities and everything. And again, when you are ready to, let's say, get discharged, you will again have a consultant who's going to work with you on, post-discharge procedures. He's going to equip with you all the education material that you would need, through the entire recovery journey and that paths that you have taken. And all that has been possible by how we integrated the different systems across hospitals, whether it is a digital health record system, whether it is a meal planning system, whether it is a pharmacy system, and that could bring out the power of all of these data platforms. So yes, that was a very, very enriching experience working with some of these healthcare providers.
That's remarkable. Thank you so much for sharing your experience. I'm sure that these impacts haven't come without challenges. Would you mind sharing with us some of the challenges that you and your team have faced and maybe how you've overcome them as well?
Certainly. I mean, challenges are there and you have to overcome those challenges. Otherwise, if the industry has to advance, certainly. Whenever there is a migration from legacy to modern systems, there are challenges. You have competing priorities within organization. You don't want to, make all of those investments in one go. You have staffing challenges. You don't have the right resources to implement all of these new technologies. You have cultural challenges. You have mindset challenges. People are, resisting changes and getting trained on new technologies. Organizations have challenges regarding their budgets. All I would say is that, yes, there are challenges, but if you don't address and you don't move forward, you run the risk of, snowballing your cost over long term. So the best way is to go step by step. Don't don't undertake the wholesale transformation. Rather choose specific goals. Either it is, you're trying to improve the efficiency, you're trying to improve the experience, chase that goal, improve the results, motivate the entire organization, have those, successful moments, and then take it step by step. But yes, you can't avoid it.
Yes, agree. A lot of those challenges that you shared are not specific just to the healthcare industry. I think it would resonate with a lot of people, even outside of the industry. But as you said, a strategy is crucial for tackling these complexities. Shifting gears, could you elaborate on how platforms can contribute to enhanced patient engagement?
That's one of my favorite topics. And it's because, I've worked in different sectors, which is hospitality and retail and, let's say travel. And I know what engagement or let's say engaging your audience means. So let's take a pause and let's understand and contextualize what is patient engagement means, because it is an overloaded term and, people use it for, everything. But from my point of view, patient engagement is a way of measuring how patient himself is involved in his own treatment, in his own, healthcare. So if an engaged patient would look like someone like, who knows exactly, what are his wellness and healthcare goals, what are his care goals. He knows, how to move from point A to point B, what are the assets and, resources that he has in his hands. He exactly knows about his healthcare records, data, vital statistics, all parameters. He knows about his own, wellness plans, routines, and he knows the cost of not adhering to treatment plans. So he's a quite aware patient. Now that sounds, fantastic. But how do we simplify this patient, or how do we enable these patients to be so engaged in their own, let's say, care journey? And that's where all of these technologies, come to play. So you have, data platforms, you have, electronic health records, you have scheduling systems, you have reminder system. That's all I would say are going to help patients. But again, they are just hygiene. One has to go above and beyond this. I mean, you have to deploy IoTs and sensors and home health devices, remote monitoring techniques. You have to use, make use of dynamic care coordination processes, methods, just to probably make that patient as aware and as engaged and, as much participative in his own healthcare journey, so that you see the outcome. And these patients are certainly, these patients are actually regular consumers. They are like you and me. Finally, you have a life where your expectations are shaped by, how do you online order food? How do you do online banking? How do you do online shopping? And that's what you're expecting when you are becoming a patient. Everything has to be on demand, personalized, instant. And that's where all of these technologies are going to help.
Yeah, it's going to be really difficult to be at that intersection of hospitality and healthcare, because we all do have these expectations of how we interact with different brands on a regular basis. But healthcare has such unique challenges, as you just pointed out. So it's almost two completely different industries that you're really having to bring together, and very unique challenges within healthcare. But it sounds like that's such a game changer. Shifting gears just a little bit, how can this change or transformation potentially also bring about some cost reduction in the space?
Let's say you streamline your data flows, you consolidate all of your data, you unlock data from different silos, bring them together in a hub. Certainly, it's going to reduce a lot of administrative overheads. It's going to reduce a lot of duplication of the data. You can also, let's say, use the power of this data for your staff planning. So let's say, how much staff do you need to serve the number of patients or the current number of patients that you have? And you would be probably better off optimizing your resources. Maybe you can also use these technologies and this data to forecast the medical supplies, so how much supplies do you need at what point in time so that you minimize your waste of resources and supplies. So, these technologies have a lot of promises when it comes to analyzing the data and, doing the predictive and forecasting in terms of the resource, staff, and capacity planning, certainly.
Sounds like a win-win. Shifting here again, could you elaborate a little bit more on how these data platforms might assist hospitals in more effective patient record management?
Yes, this entire thing about, digital health record management is becoming very, very important. And it's because in the last few years have really changed the way healthcare is delivered, right? The need for digital transformation has put immense pressure on all complex layers of the healthcare system. So electronic health record, as they call it, is the holy grail of digital transformation and how do you, deliver the healthcare. So they are not just the necessity, but, someone needs to prioritize it. And I believe, more than 50% of the patients across the world today don't have access to their own health records. And modern data platforms are going to certainly help in, collecting this data, bringing this data to the, to the people who need it the most, which is, the patient himself. So that's, I would say the digital health record is going to be the cornerstone of the entire digital transformation this industry is going to see in next few years. And modern data platforms certainly, makes up the backbone for it.
It sounds like we can get a little bit more into interoperability.
That's a challenge which comes with, all of this digital health record and consolidated data. True.
Unification, the unification of data and interoperability. Where does that really impact the healthcare market specifically?
Yeah, so it's like, imagine a patient which had a multifaceted medical journey over a life, over a period of time. He has seen multiple specialists, multiple healthcare institutes, and his data resides everywhere. So when you go to, let's say, the fifth clinician, that person doesn't have the entire history of, what you have gone through, what you have been prescribed to, what kind of, allergies do you have, what kind of care you have been already given. So the interoperability means, collecting data from all of these digital health record systems and, bringing a comprehensive one picture of the patient health record. We call it, let's say, longitudinal health record, which is a lifelong snapshot of, what has happened to you. And that gives a lot of insights into your present health condition and also actionable, insights into how your future, care roadmap could look like. So it is certainly very important. And EHR is only one part of the equation or one source of the data. Now people have variables, there is a genomics. So everywhere, there is a health data, wellness data, nutrition data, everything has to come together to create a holistic, health plan for an individual. So yes, interoperability is certainly, it's a must. It's not even nice to have.
Yeah, absolutely. I think as a marketer and somebody who's in the data space, one source of truth for all data, the possibilities are endless.
All of these modern platforms today, they have tools and technologies. They have open standards from where, they can, let's say, extract all of this data, bring it into a non-proprietary technology when it becomes more accessible, more shareable. So without this, I think interoperability cannot be achieved.
Absolutely. So as somebody who's in the industry, I get really excited when I think about breaking down all of the barriers and silos between data and one day being able to create this experience in healthcare where all of that's available and unlocking all of these great possibilities that you've shared. But as a consumer and among rising concern about data breaches and being concerned about my own security around data regarding my health, how do modern data health platforms manage those crucial aspects of security, compliance, and data protection in such a highly sensitive industry?
Your observation is very fair. So as you merge all of these data sources, safeguarding in the protection of the data becomes intricate. It becomes all the more important. And as we bring, more data sources, we open up more and more, we make ourselves more vulnerable to, data breaches and privacy issues, etc. So the good thing is, while, modern data platforms gives you tools and technologies to merge data, unlock data, provides you a platform for analyzing the data, they also come with built-in and, out-of-the-box governance and security technologies, right? So, using this platform itself, the administrators can define and design the access control rights. They can design who can access the data, who can run the analytics, how can they save this data from getting compromised. And healthcare is such a regulated industry. You have a lot of compliance, to be taken care of. You have a lot of regulation. And these regulation and compliance needs are frequently changing. And it's such a dynamic scenario that healthcare organizations are find it difficult to cope up with. And that's where it's even more difficult to imagine that without any such tools and technology, how can you even have that kind of an agility that, today you are here in terms of compliance, but today, the regulation wants you to move there and you can quickly, move that. So yes, in that terms, it is a lot valuable that we use such platforms and also the technologies for the governance and security that these platforms provide.
Great. Thank you so much. We really, really appreciate you taking the time to share your experience and really enjoyed hearing all of the great things that DigiValet is doing today with digital platforms. Thank you to our viewers. Now they know the importance of a modern data platform in healthcare. Let's create a data-driven future for better patient outcomes.
Thank you, Megan. I really enjoyed this interaction.
Thank you all for watching. Let's embark on the modernization journey today. For more information, visit impetus.com.